So we're here in our newly remodeled lab. This actually used to be our staff room, but we had such a need for having space to work on the cases that we do and to house our technology that is necessary to execute these cases, that we really needed some dedicated space. So we found some other space in the building for our staff. And so now they have a nice space to relax there, and we have this space to be able to work on our cases, our cosmetic cases, our implant cases. And this is an implant case that I'm working on right now. This is a patient who over the years has lost several teeth. She's always felt hopeless about her mouth, that it was like, you lose a tooth here, lose a tooth there. She's currently wearing partial dentures, which are fake teeth that snap on to her existing teeth, and she's got along okay with them, but is really looking to do something more permanent and taking the opportunity to feel good about her smile and her bite, and to be able to function and chew and not have to worry about her teeth. So where we're at with this is we've digitized her case, which we see here. So these are her teeth, her current teeth, and then we mocked up some teeth to replace the missing ones. So that's her existing teeth with a proposal of new teeth overlaid on that. And this would be equivalent to like having a blueprint in a plan. If you were doing a remodel and build a house, you need to have a blueprint. You need a plan from which to start. So this is a proposal. From here we can start planning for implants and taking into account where we want the teeth for where they work best in her mouth and her bite and the aesthetics, and considering where she has bone to be able to put these implants. So we have to look at the bone, and this is, let's see, we have that's the skeleton. So where in the bone can we house these implants and where they're going to fit with the teeth. So those are all the implants, so we can see where they fit with the bone, where they fit with the teeth. And then from there, what we do is make we call a surgical guide, which is a guide that fits on the teeth, registers the placement of the implants, so that we can duplicate our plan and have a predictable outcome. So basically, the guide looks something like this, and this is what we make in our office here. Fits over the teeth. It has a slot for the drill, so that the drill goes in there where we had planned it on the computer. And these are what we use to make the space for the implant, and the implant acts as the root of the tooth that fuses to the bone, and then from there we build the tooth on that implant in the form of abutment and a crown, or maybe just a crown, depending on what's most appropriate. So this is a printer that we use to make our surgical guides. So we've got that going right now, and our CEREC machine, which we use to make the crown. So hopefully that's helpful. For us, it's really important that people know what we're doing in dentistry, what's out there, and what you can expect from what dentistry has to offer, and what we can do for you. If you have any questions, reach out. We're happy to discuss anything that's going on in your guys' heads. So please feel free.